Thank you very much, John Cole. I'm glad to get the opportunity to talk on this very important matter here this evening. First of all, elderly people have been massively impacted due to this virus. All those ones that had to isolate or this new world cocoon at home, it has changed their lives utterly, and many of them won't be ever the same again. And I was very hurt recently when the government suggested that elderly people needed to be careful, and you weren't sure whether it was they were going to give the virus or whether they were going to get the virus. And I resented and rejected that comment by government. Anyway, the people at home are one thing, but the worst thing that happened during the virus, Minister, was the fact that elderly people died in nursing homes and hospitals on their own. That was actually the very worst part of the whole pandemic and the whole thing that hit this country, because family members and elderly people like to have their families with them. It has been traditional back over the years as they were approaching their last days. This didn't happen, and I'm very sorry. We see it in the television the other night where elderly people died and were just thrown into a body bag and put into a coffin, and no one, they had to stand outside the graveyard. So terrible. In the first day, when Deputy Martin, now our Taoiseach, took leaders' questions, I got the opportunity through the good facility of our Cloncola to ask the Taoiseach to ensure that families could visit their elderly relatives in nursing homes and in hospitals. I'm sorry to say, Minister, it's not happening. And if it does happen, it's the very rare occasion where someone is wheeled out to a door, and an emergency exit door in a hallway or something like that, and an elderly person coming visiting has to stay outside, whatever the elements are like. That's not satisfactory. And we need to develop some way that either the families are tested coming in, or the family, the person in the home or the hospital is tested. But we have to ensure that family members visit. And just I have one question to ask: is there a member of the public health advice team involved in producing test kits? We need to know that, because the test kits are a savage price and they're costing people undue.